Listen, if you're one of those people who suffer from pain down the leg, in the foot, it's called neuropathy, you're going to enjoy hearing my next guest, Dr. Kelly Miller. Dr. Miller, thank you for being with me, sir.
Glad to be here.
So let's talk about this, because I mean, there are a lot of people who suffer with this pain.
There are. There's at least 10%, maybe 15% of the population has some form of neuropathy.
Wow. And is that kind of an increase that we've seen over the past several years, or has that been a...
Definitely on the increase. You know, one of the reasons, probably 30% of neuropathies are caused by diabetes. And then we have that growing population of diabetics, so you have more neuropathy. We have a lot of people who are on statin medications, you know, for cholesterol.
Right.
And that can also cause neuropathy. And we have more and more people that are on prescription antacids for acid reflux, GERD, things like that. That interferes with the absorptions of key minerals and vitamins. That creates more neuropathy.
Jeez Louise, man. So we've got this whole population out there who are suffering, but really nothing to do about it.
Yeah, there's the standard treatment for, if we're talking about any kind of nerve pain, is usually Neurontin was the first medication, probably came around 15, 20 years ago. Gabapentin is the generic form. They now have Cymbalta, Lyrica. An older medication is called amitriptyline. So usually they're going to try one of those medications. If that doesn't work, they'll do a combination of some of those medications. If that doesn't work, then they're going to start on some type of narcotic, a hydrocodone, Oxycontin. I had many patients that were even on methadone.
Wow. And really that doesn't do anything to correct the problem, it just keeps the symptoms down, is that right?
Exactly, it does. And some patients, you know, if they're lucky, they get, if they have a milder case, they may get a very good reaction to the medication, but many patients, because of the side effects, can't take the medications, there's really nothing for them to do except to get into the narcotics, the extreme end of that. And for the numbness component, it sounds funny, but most of these people have pain and numbness simultaneously. They have the nerves are injured, so they're painful. Yet when we do sensory testing, they've got a loss of sensation, which
don't feel it.
Right, so it makes them more increased risk for wounds, balance problems, falls, things like that.
So you have the average person that comes into your office. Here I've got neuropathy. Do they feel like almost they're at their wit's end?
Well, a lot of time they do. You know, because they've tried the medications, they shuffle between one because it didn't work. They tried another, or they're stepping up their medication all the time, and their symptoms are getting worsening. It's starting to affect. You know, they're not sleeping at night. They're having ambulatory problems.
Sure.
Their quality of life is going down. And the sad thing is they've been told most of the time by their doctors is that there's nothing, you can't fix it, you can't do anything about it.
And so oftentimes a treatment is just to watch them, basically watch them go downhill. Right,
they monitor them, and initially they'll start medication, stepping up the dosage and do more aggressive things. And the end result for someone who doesn't respond to medication is something called a dorsal column stimulator, and that's where they go in and implant an electrical device that just blocks the signals.
Wow. Still a problem in there, but it's just blocking the signals of pain, is that right?
Right, the same thing is going down, the nerves are still being damaged, and they're losing sensory, and it starts in the feet, and it works its way up. So it can go to the ankle, then it goes to the mid-calf. So I've had patients that came in and they were numb all the way to their knee.
Wow. I want to come back just a couple of minutes because I believe you found some answers for this. And I want us to talk about that. Is that okay?
Absolutely.
Okay, don't change the channel. We're going to be coming right back. If you've got this problem or you know somebody who does, get your pen and paper ready because it's time for you to find an answer. We'll be right back. Okay, so here you are suffering with this excruciating pain or even numbness down in your leg. You don't know what to do about it. I'm glad you're with me today. I'm with Dr. Kelly Miller. Dr. Miller, we've been talking about this thing called neuropathy. What does that mean, by the way?
Well, neuropathy is a very broad term that means something's going along with a lot of nerves. And there's basically 4 different categories of neuropathy. One is spinal related. I actually call that radiculopathy, but it's from something called stenosis, a narrowing of the openings in the spinal cord or the nerve roots. Could be from degenerative disc, arthritic changes. And that will produce numbness, tingling, pain, weakness in the lower extremities and feet. We have nerve entrapment neuropathies. Most common, like one that most of us know about, is carpal tunnel.
Okay.
That's a nerve entrapment in the wrist. That's considered a neuropathy. We have peripheral neuropathies, which we're talking about mostly today, and those are caused, and they affect the nerves longest in the body. Usually, the first toe, second toe are involved, and they progress as way up. Diabetes is one. Statin drugs creates another. Heavy metal poisoning creates that problem. Again, side effects from different medications. Then there's other neuropathies created from systemic problems, a lot of them autoimmune, like HIV, lupus, scleroderma, different things like that.
Okay. And so, as a patient comes into your office, oftentimes at wit's end, you basically sit them down, do a consultation, and then go through an exam to find out if indeed there is a neuropathy present.
Absolutely. So what we do is we start with the spine, because the nerves, if it's a lower extremity problem, we start in the lumbar spine and work our way down. If it's a problem in the upper extremities, we work in the cervical spine and down to the fingers. So we're trying to determine, is there a spinal component of that? We do motor testing, we do reflex testing, we also then do extensive sensory testing with different instruments.
Okay.
And many of these times we've used something called nerve conduction velocity studies, or EMG, electromyography. And we also, which many times patients will have these symptoms, and those tests can be normal because the nerve conduction velocity test only checks the large fiber, which is about 40% of the population. The small fibers are 60%. So if you only have small fiber neuropathy, it's not going to
Could be a lot missing.
A lot missing, absolutely. So we use something called a neurometer, and it picks up those small fibers.
Wow, which is invaluable, man, I'm telling you.
Absolutely. So we can quantify it. If you can put a number on it, then we know we can go from point A to B. We can gauge progress on the patient.
So then a person, you find out they have indeed neuropathy. Your treatment then?
Well, the treatment is dependent upon if they have a spinal component, then we use a decompression type traction to try to create more space around that nerve impingement. And then the other modalities are threefold. We do a specific nutritional regimen with the patient, and that's dependent on what kind of neuropathy it is and the severity, as far as how much we do and for how long. And then we also do an infrared light therapy under a specific spectrum of light.
Okay, now, but let's hold on here now,
Okay.
because I eat really good. I think I'm going to get the vitamins and everything that I need in the food that I eat. I probably don't need the nutrition.
Well, if that was true, you probably wouldn't have the neuropathy. But actually, some of the things that happens, it's very common, even the medications that we're prescribed many times cause, in fact, a B vitamin deficiency is one of the most common side effects from about every medication. So if you're diabetic, the first thing they try on usually is metformin. Well, metformin causes a B6, B12 deficiency, which is essential to normal nerve function. Statin drugs for cholesterol cause a coenzyme Q10 deficiency. Again, another nutrient that's key in there. So not only are you probably not eating optimally, you're not getting enough. In fact, there's numerous studies that show about 80% of Americans are deficient in one or more B vitamins.
Wow.
And that's probably true for every other, magnesium, zinc, lots of other things. So most of us needs a little help in that area.
So you zero in on exactly what's needed for that patient nutritionally.
Right. So there's even a different protocol whether if the patient has something called axonal nerve injury or myelin sheath. So the axon is like if you think about a wire that's going to plug in the cord. The wires inside are the axons, and then the outside plastic covering is the myelin sheath.
Wow.
So they will need different nutrition.
It's understandable. That makes sense. So we cover nutrition. Then the next thing is?
The next thing is we use a type of infrared light therapy. And the infrared light therapy creates something called photobiostimulation. Photobiostimulation is to animal cells like photosynthesis is to plant cells. So plants use sunlight to help part of and water and nutrition to grow. And normally our skin keeps infrared light from penetrating, but this technology allows that to penetrate into the cells and activates the mitochondria, which is the power plant of the cell. So it causes all the things to do for that cell to repair.
So we got nutrition, we've got the light.
Infrared light therapy.
Infrared light therapy. You said number 3.
Number 3 is a type of therapy called synaptic therapy. So it's different. Many people have probably heard of TENS units. They operate at a different frequency, about 100 hertz. That's impulses per second. In our office, you know, we might have an instrument like it's called interferential, and that might operate to 4,000 hertz. These instruments go to 40,000 hertz, and what we find that these increased frequencies, close, you know, in the 20,000 range, actually cause an acceleration of nerve repair. The nerve, it actually helps the nerve repair and grow faster.
You're telling me even where there's been damage that the nerve can repair itself?
Absolutely.
Wow.
You know, we know if we cut a sensory nerve, a peripheral nerve, it will regrow 1 millimeter a day. So what we're doing is we're creating the optimum environment. We're giving the body what it needs, all the raw materials to repair that nerve. We're increasing the metabolic rate of that cellular function with the infrared, and then we're causing an electrical stimulus that actually helps stimulate the nerve to hyperpolarize. It's called hyperpolarization, to repair it at an accelerated rate. So we're creating an optimum environment for nerve repair.
And you've had people respond really well to this?
Yes, we've had all kinds of patients. I've had patients from diabetes, patients from chemotherapy, heavy metal poisoning, Agent Orange. I've had many veterans, you know, come in. And I've even had the approach has actually helped someone who had a sensory injury from a gunshot wound in the leg.
Wow.
So it seems to work, you know, it's 80, 90% of the time on whatever type of injury.
And that's a pretty good odds.
It's very good. The motor nerves recover. We've done some studies where we did sensory motor, and the motor nerves also were recovering. And obviously there's cases that are too far gone that we can't help, but the majority of people can get a lot better.
Wow, that's amazing. Thank you for letting me be here with you.
Thank you.
Listen, if you are suffering, I want you to call this number right now and make an appointment with Dr. Miller. I'm telling you, you don't have to suffer. Call the number right now, go to his website, check it out. Now don't change your channel because we have more coming up in just a minute.